Intrauterine Insemination IUI. What is IUI? Procedure to treat infertility by ovaries stimulated to produce more eggs, seminal fluid washed in artificial media and introduced into the uterus, sperms swim towards the egg for fertilization to take place. Entire procedure takes 15 to 20 minutes. Indications of intrauterine insemination. Infertility due to abnormal semen can be either due to abnormal sperm shape, motility, and viability. IUI helps to separate the normal sperms from abnormal sperms, thus achieving fertilization. Cervical factors. Abnormal position of the cervix preventing sperm travel to the egg. Thick cervical secretions during ovulation, thus preventing the sperm ascent to the uterus and to the egg. Ovulation problems. Semen allergy. Some women are allergic to the protein in the semen of their husband, which causes discomfort after intercourse, so most couples prevent intercourse, thus preventing pregnancy. Unexplained infertility. There are many unexplained reasons for infertility for which the only treatment solution is IUI. Anti-sperm antibodies, erection and ejaculation disorder, mild endometriosis. The cases in which intrauterine insemination is ineffective: blocked or damaged fallopian tubes, ovarian failure, severe seminal fluid abnormality, severe endometriosis. Preparation for intrauterine insemination, artificial insemination. Monitoring ovulation. Monitoring of ovulation is done by vaginal ultrasound after the woman is given ovarian stimulating drugs to make sure of the maturity of the follicles. Doctors usually prefer having at least 1 to 3 mature follicles to give the HCG injection. Preparation of the semen sample. After 2 to 5 days of abstinence, semen is collected in hospital. Normal sperm is isolated from abnormal sperms. Sperm separated from other components and concentrated in a media. Total time for sperm preparation 30 to 60 minutes. Intrauterine insemination procedure. Done in the clinic of the doctor, and there is no need for medication or an analgesic during the procedure. Speculum is placed in the vagina and cervical area is cleaned. Specimen of highly motile sperm is placed in the uterine cavity using a special flexible catheter. Success rate of intrauterine insemination IUI. The pregnancy rate of IUI is 10 to 20%, and it depends on the age of the wife, her health situation, and also on the number of motile sperm that is used in each cycle. And the pregnancy rate in 2 IUI cycles using 5 million sperm is more than the pregnancy rate in 1 IUI cycle using 10 million sperm. For couples of unexplained infertility trying for 2 years, female age under 35 and normal sperm, the success rate is as follows: 10% chance per month using Clomid and IUI for up to 3 cycles, 15 to 20% chance per month using injection by FSH medication and IUI for up to 3 cycles. Risks of intrauterine insemination IUI. Rarely, IUI may cause infection in the uterus and tubes from bacterial contamination that originate either from semen sample or contamination of sterile catheter in the vaginal or cervical area during the procedure. Careful cleaning of the cervix and cautious technique elevate this and make it a rarity. Commonly asked questions: how many times can the IUI be done? The IUI is usually done twice during the treatment cycle, and it has been proved that doing the IUI twice increases the pregnancy rate because it decreases the loss of the fertility during the ovulation. But there was a study that was done comparing the pregnancy rate after IUI on 1 time or 2 times and found no difference. After the intrauterine insemination, any lifestyle changes is required. Usually the IUI procedure takes from 15 to 20 minutes. The patient is then asked to lie down on her back for a period of time. The patient can continue her normal life, and passage of a small amount of blood in 1 to 2 days after IUI is normal. When to expect the intrauterine insemination results? Pregnancy tests should not be done before 2 weeks have passed since the IUI, during it which may cause false negative result, which means that the patient is pregnant while the test is negative, and in cases where hormones are used for ovulation induction like HCG, during the pregnancy test before 2 weeks can cause a false positive result, which means that the patient is not pregnant while the test is positive, that is caused by the HCG hormone that is found in the blood. If intrauterine insemination fails, when it can be repeated and how many times? It can be repeated 3 to 6 times to increase the pregnancy rate. It can be repeated after at least once a month or more. This depends on the doctors and the couple's mutual decision. If IUI fails after 4 trials, it is preferred not to repeat it. The doctor will decide the next step according to the case. To get world-class infertility, IVF, gynecology, and obstetrics facility, visit us at www.layus.com or visit us at our Facebook page.